Hello, everyone. Good afternoon. Kimsey here, and I'm so glad to be here today. I am going to be talking about a topic that is maybe kind of elusive for some people, but I bet a lot of people will resonate, and I hope it perks if you are listening and you have these seemingly weird symptoms that seem like they're not all connected, but deep down you feel like they might all be connected, but no one's really listening to you. You feel dismissed often by doctors. Then this conversation is for you. So I'm going to jump right in. My name is Kimsey Berkwin. I'm an integrative nutritionist in my online nutrition and wellness practice called Progressive Health and Wellness, where I work with ambitious men and women who are struggling with their mental or physical health by taking a root-caused body-mind approach to optimize their health and wellness. And today, what I'm going to be talking about are 7 signs that you might have histamine intolerance. So if anybody's listening right now and you've heard of histamine intolerance, maybe you're curious about it, but you don't really know what it is, or maybe you suspect that you might have it, you align with a lot of the symptoms and you want to learn more. I'm so sorry. This hair is driving me nuts. Then comment below, share with me, what brought you to this talk? Are there any questions that you have or anything specific that you want to learn about it? Make sure if you're watching the replay or if you're watching me live right now, tag me in it and I'll go back and answer if I don't see it right in the middle of the talk. Okay, so what I'm going to do, I'm going to talk us through a brief overview of what histamine intolerance is, kind of the basic mechanisms of how it works. Then I'm going to go through 7 symptoms that when I hear these, and especially when I hear these all together, really perks up my ears for the possibility that we might be dealing with histamine. I'm going to give a little bit of information about common root causes of histamine intolerance. It's not really the intention of this talk, though. I want to make this talk more approachable, just kind of a quick hit of, hey, might I have this? I align with those symptoms, or no, I don't. What can you do to find out more? If you do want more information about histamine intolerance and a detailed explanation of common causes, solutions, the whole process that we take, go to my private Facebook group, Holistic Solutions for Mental Health and Wellness, search histamine intolerance, and you'll find it there. I've given a lot of information, static posts, live posts about the ins and outs of histamine intolerance. And then, of course, I'll share a little bit today about the approach that we take. But again, that's a much more expanded conversation. So I would go to that Holistic Solutions for Mental Health and Wellness Facebook group. It's free, it's private, and you can find out more of those detailed information. Okay, so histamine intolerance. What is it? So histamine is a chemical that is used throughout the body. Most people, when they hear histamine, they think of maybe antihistamines, like allergy medication, right? Correct. That is one area by which histamine is used. So histamine is used by the immune system to mediate the allergic response. So if we're exposed to pollen, for example, outside, what happens is an antibody from the immune system binds to what's called a mast cell. That's a term that you'll want to remember. Binds to a mast cell, and that causes the degranulation or the breakdown, if you will, of that mast cell to release over 200 different chemicals, histamine being one of them. And the intention behind those chemicals is to help attract the immune system to that site of perceived injury or threat so that the whole force of the immune system can be used to destroy it, in short. But that's only one place that histamine is used. So we actually have 4 different receptors for histamine, and it's all throughout the body. So we have histamine receptors in the digestive tract. We have histamine receptors on the immune system, of course. We have them in the brain, and we have them in the endocrine system. Now, mast cells are the source of histamine. Not the only source. I'm going to come back to that. So what that means, but mast cells do not need IgE antibodies to bind to them in order to release histamine. That's only one mechanism. Mast cells can be stimulated by other environmental triggers or immune triggers or hormonal triggers, other triggers other than IgE antibodies, which is what initiates the allergic response. So changes in temperature, fluctuations in our hormones like estrogen or progesterone, cortisol, environmental toxin like mold, for example. All of these different things can trigger the release of mast cells, causing the release of histamine. It's also worth mentioning that gut bacteria can also produce histamine. So this is going to come full circle when I start talking about fermented food. But gut bacteria, when they interact with histidine, which is an amino acid found in foods that we eat, they can basically convert histidine into histamine. So gut bacteria can be another source independent of mast cells that causes the release of histamine. And then mast cells line the digestive tract, they line the sinuses, the lungs. I mean, they're all throughout the body, all throughout the body. And so there can be food triggers, bacterial, pathogen triggers in the digestive tract that also really cause the release of mast cells in the digestive tract, or the stimulation of mast cells in the digestive. So that's where mast cells, gut bacteria, and then, so that's how it's produced. Then we have two main enzymes, just like anything in the body. You want to use it and then lose it. You want to produce it and then lose it. We're always in that balance, right? Of building and breaking down. So we have two main enzymes, diamine oxidase and N-methyltransferase, that help metabolize or break down histamine. Diamine oxidase lines the digestive tract specifically. N-methyltransferase is in the liver. And this is where the bucket analogy comes in that you will often hear when it comes to histamine intolerance. And that is, if we have water pouring into our bucket, basically we never want our bucket overflowing. So if we have water pouring into our bucket, i.e., what is triggering the release of histamine, those factors I mentioned before, toxins, hormonal shifts, gut bacteria, infections, etc. We want to have an adequate outflow of histamine on the other end. So we want to poke enough holes in our in our bucket so that water is pouring out the other end. And that's where those two enzymes that metabolize histamine come in. And when working in unison, those two things keep our bucket from overflowing. However, if we have an overproduction, so we might have mast cell hyperactivation, we might have genetics that predispose us to an enhanced chronic inflammatory response. We might have infections, hidden low-grade infections. We might have hormonal imbalances. We might be exposed to hormonal imbalances, especially estrogen, progesterone, cortisol are things that come to mind. We might be exposed to toxins without our knowledge, like living or working in a moldy building, exposure to heavy metals or other chemicals, right? All of these things might be, have nervous system dysregulation. That's a really big one. Have experienced trauma as a child. That's a really big one. So all of these things might be pouring water into our bucket, right? But if we can't adequately metabolize it, so GI inflammation of any kind will decrease our diamine oxidase activity. So we're not adequately metabolizing histamine from the digestive tract. And then nutrient deficiencies, poor liver, poor drainage pathways, so poor liver function can also inhibit N-methyltransferase. So for example, B vitamins, methyl donors are really important for N-methyltransferase. Zinc copper balance is important. And then again, adequate liver and function and bile flow is also very important. So if either of these enzymes aren't operating at their best capacity, then the combination of these two things causes the histamine to accumulate and our bucket to overflow. And when that happens is when the symptoms of histamine intolerance manifest. So now, what are those symptoms? They're vast. first of all. But here are 7 that if I hear these in an appointment, and like I said, especially if I hear the majority of them, then I start to see a red flag that we might be dealing with histamine intolerance. So what are they? I wrote them down. So you're going to see me reading the list. First is frequent headaches or migraines, especially migraines. If somebody has a history of migraines, and especially if they're frequent, I'm going to suspect histamine. Anxiety and panic attacks. This is another really big one. Especially, some people may find that they respond really well. There's a medication, an anti-anxiety medication, I believe it's called hydroxyzine, that actually targets the histamine receptors in the brain. And if they're responding well to that, that's another red flag. Skin flushing or rashes. So just kind of general redness, like a flushing. People might notice that they exercise and they get like really red, like excessively red for the amount of exertion they're putting into it. Almost can look like rosy cheeks or like rosacea. Or rashes. Could be eczema. It could be hives. It could be what appear to be like fungal rashes, or sometimes they're like mini red dots. All of those would be red flags. Number 4 is congestion or sinus issues. So if they have frequent congestion, but it's not like allergy season, they don't have a cold, right? Then that would be another red flag. Digestive symptoms. So this can take the form of many forms, I should say, take many shapes. Big ones, though, are acid reflux and nausea and bloating. And then we'll see sometimes constipation, sometimes diarrhea, sometimes mixed. Irregular menstrual cycles or symptomatic menstrual cycles. So there's a relationship between estrogen, progesterone, and histamine. Estrogen increases histamine production and increases histamine activity. Progesterone does the opposite. It calms histamine production and it calms histamine activity. And so when you start charting out when a woman is having symptoms throughout her menstrual cycle, you can start to correlate if there might be some involvement of histamine. We'll also often see a condition called estrogen dominance, where there's high estrogen to low progesterone, because histamine also increases the production of estrogen and it decreases the production of progesterone. So it kind of creates this vicious storm. So what I mean by irregular menstrual cycles, women might have breakthrough bleeding around ovulation. They may have too long or too short of a menstrual cycle, so less than 28 days or longer than 35 days. They may have a regular menstrual cycle, meaning they get it every like roughly 28 to 32 days, but they have a lot of symptoms, right? They might have a lot of symptoms around ovulation, and then a lot of symptoms leading up to the menstrual cycle. PMDD, exhaustion, dizziness, possibly heart palpitations, really painful cramping, really heavy menstrual cycle, breast swelling and tenderness, water retention, breakout of rashes. Those are the kinds of symptoms that we're talking about. It may manifest as seemingly normal symptoms, meaning like irritability, PMS, painful period, like cramping. But again, if we're seeing it in the context of these other histamine symptoms, it'll be a red flag. Okay, and then lastly, sensitivity to aged or fermented food or alcohol. So here, aged food, we're talking, think charcuterie board, right? So think like aged meats, aged cheeses, cured meats, things like that. Think of with fermented food, I mean, any of it, like that's where alcohol comes in. It's because it's fermented. It's also because it affects the liver and intestine in the digestive tract. But think like sauerkraut, kimchi, yogurt, collagen is actually, that doesn't fall into either of those categories, but it's worth mentioning that collagen is high in histamine. Vinegars, things like that, olives, pickles. So this brings us full circle to how gut bacteria can also produce histamine. That's the problem, is these aged and cultured food and fermented foods, it's the bacteria that's doing that, that's aging it, and that's responsible for the fermentation process. And the longer that these bacteria have to interact with the proteins and the sugars that are on that food, the more time it has for the histamine in that food to elevate. So those foods inherently are high in histamine. Now, normally in the digestive tract, if we have healthy levels of DAO, that's not a problem. Our digestive tract will break down that histamine. But if we don't, then that will just dump a bunch of water into our already overflowing bucket. So there are other symptoms that come to mind: heart palpitations, dizziness, low blood pressure, fast heart rate, things like that, joint pain. There's really a ton, but these are big red flags to me. And again, if I hear them all or a lot of them together. So what do we do from there, right? If I suspect histamine intolerance, unfortunately, there's not really great labs to run for this. There's one that I will sometimes run. It is actually a stool test, and it looks at the amount of histamine in the digestive tract, the DAO activity, as well as what are called lipopolysaccharides, which are inflammatory components of outer membranes of different bacteria. So sometimes we run that. I don't run it all that often. You can test histamine blood or histamine in serum. You can test tryptase. There are other like mast cell chemicals that you can test, but they're not very stable. Not to mention, these histamine levels are constantly fluctuating in the blood. And so if you happen to draw someone's blood when they're really symptomatic, you might get an accurate result. It might show up high. But if they're not, or if their histamine doesn't happen to be that high at that particular time, then it might look normal. So the testing for histamine intolerance really isn't that great, is what I'm getting at. And symptoms and history are by far the better way to evaluate if somebody has histamine intolerance. So what I'll do if I suspect that is I'll start by putting someone on an anti-inflammatory diet combined with a low histamine diet. So I'll usually do kind of a paleo-esque approach. We remove some of the key triggers like gluten and dairy and soy and corn and sugar, really emphasize whole, minimally processed foods. And then we'll do a trial of taking out those higher histamine foods, the fermented, the cultured. In some cases, if I really suspect it, then we'll do a full low histamine diet, where it also removes histamine releasing foods, so foods that down regulate the activity of DAO. Things like tomatoes, spinach, chocolate. There's a variety of different foods on that list. Avocado. We'll also remove that. And then I will arm them with histamine metabolizing support. So this can look like sometimes medications. Sometimes we use like over-the-counter antihistamines, like Pepcid to support histamine and the reduction in the digestive tract, or like Zyrtec or Claritin or Allegra. People tend to respond better to one of those. So we'll experiment with some of those. Sometimes it looks like using supplements like vitamin C or quercetin or nettles that have all been shown to be helpful for stabilizing mast cells, and also liver support for sure. So like castor oil, Epsom salt, saunas, milk thistle, N-acetylcysteine, glutathione. There's a variety of things that we'll use. B vitamins. There's a variety of things that we'll use to support the liver. But generally what I'll do is I'll take 3 to 4 weeks of that approach. We'll start implementing some nervous system regulation techniques. Take 3 to 4 weeks of that approach and see how much they respond. And if we're noticing, we know that's what we're dealing with. And then, I should have mentioned in supplements, supplementing with DAO is often something that we do too. All the while we're running lab tests, because ultimately the quest is to figure out what are the environmental factors that are causing the excess of histamine. So we want to support the breakdown of it, but we also want to figure out what within the environment or within their body is pouring all the water into the bucket, right? So that's where we'll run things like a stool test for sure. Diet comes into play with that. And then it really depends on the person. If there's mold suspicion or exposure, we'll run a mycotoxin test. If there's heavy metal suspicion, we'll run a hair heavy metal test or sometimes a urine heavy metal test. It really depends on the person's history, sometimes a hormone test if they're showing a lot of hormonal imbalance signs. But again, we'll run these functional lab tests to get an assessment to try to figure out what's causing the overflow of histamine. But what tests we run depends on the person. I will say a stool test is always involved. And we do run blood testing on pretty much everyone that will look at liver function, kidneys, immune system, zinc, copper, B vitamins, vitamin D, things like that, iron. And then the more nuanced approach depends on the person too. So we're dealing with like mold or SIBO or gut infections or hormone imbalance, like whatever it might be, then we'll kind of go down those individual paths. But the first part that I outlined about nutrition and nervous system regulation, liver support, and metabolizing histamine support, that I would consider foundational. So that kind of summarizes histamine intolerance in a nutshell. Like I said, there's a lot more expansive, nuanced information that you can take. Go to that Facebook group, Holistic Solutions for Mental Health and Wellness. I will say we've worked with this a lot. It seems to be on the rise post-COVID. And there can be a lot of success. It can be really frustrating for people because the other thing I should say too for symptoms, the 8th symptom is if you don't tolerate a lot of foods, supplements, or medications. Like if you're the sensitive one, right, and you're starting to notice a diminishing tolerance for foods and your list of tolerable foods keeps getting smaller and smaller and smaller, or like, supplements, someone says to take 2 capsules twice a day and you have to take like a quarter of one capsule and that's still causing symptoms. Like those are some examples. That's another big red flag of histamine issues. But that's why I'm here to say, like, the buck doesn't have to stop there. You can get answers. You can get solutions. It just requires working with someone that really knows the ins and outs and what they're working with. So if that describes you, again, go to the Facebook group if you want more information. But if it describes you and you're like, holy crap, this person just described what I'm dealing with, and you're ready to find answers and solutions, I invite you to schedule a free 15-minute call. It's linked in the description of this talk. Schedule a free 15-minute call with me. What we'll do in that call is talk more about the symptoms, the health challenges that you're having, what your goals are, what you're looking for. I'll share more about my practice, the process, what you can expect. And if it feels like a good fit for both of us, then we'll talk about what next steps look like. And if it doesn't, that's okay too. So I hope this was helpful. And stay tuned. I'll be back on here next week. Have a great rest of your day. Bye.